Perioperative Medicine, the pathway to better surgical care. At the Australian and New Zealand College of Anaesthetists, ANZCA, we've been thinking about how to make surgical care safer by integrating the care patients receive before, during and after surgery. More than 3 million patients undergo surgery in Australia and New Zealand every year, and we believe there's huge potential to make the system work better, particularly for the growing group of more than 500,000 people who are at high risk of complications if they have surgery, and who account for more than 4 out of every 5 deaths after surgery. Here's an example. Meet Joe. He's just been diagnosed with bowel cancer, and his surgeon has told him he needs an operation to remove the tumour. Joe's GP has been treating him for lung disease caused by his smoking and is aware of some problems with his kidney function. But despite his lung disease, Joe says he feels fine. In some hospitals, Joe's anaesthetist and others looking after him may not receive this information until the actual day of his operation. Despite the lung and kidney issues, it's thought that surgery is Joe's best option. Like the majority of operations, it is a technical success and the tumour is removed. But a few days after surgery, Joe's weakened lung function deteriorates and he develops life-threatening pneumonia. So Joe has an emergency admission to the intensive care unit for more comprehensive treatment. He ends up staying in hospital 5 days longer than originally planned before he's well enough to go home with his family. As well as the pneumonia, Joe's kidney function gets worse. But because he doesn't show any symptoms, it goes unchecked. And in the months that follow his operation, Joe gradually develops chronic kidney disease. So despite successful surgery for cancer, Joe is actually less healthy than before his operation and eventually requires kidney dialysis treatment 3 times a week, which undermines his quality of life and life expectancy. When we zoom out and look at this pathway and see Joe's repeat visits to hospital, we can see it's very complicated and undermines his quality of life. Let's compare that to another pathway for Joe, based on the Australian and New Zealand perioperative patient pathway, where we take a more integrated and better planned approach. This means that a team of doctors come together to plan for Joe's care as soon as he is referred for surgery. One of the doctors on the team, in this case an anaesthetist, oversees his surgical journey. Joe's GP passes on information about his other medical problems so that the team and Joe can decide the best way to proceed. They help him to cut back smoking, reduce his alcohol intake, and improve his diet, and put Joe on an exercise program to improve his lung function and fitness before surgery. The team also alert a kidney doctor to monitor Joe's kidneys before and after surgery. Now, after Joe goes in for his successful surgery, he has a planned admission to the high dependency unit for a couple of days straight after the operation, so he gets extra care from doctors and specialist post-op nurses and other allied health professionals, including physiotherapists. Because of his specialised care, he is able to avoid pneumonia and worsening kidney problems. The perioperative anaesthetist, the geriatrician and Joe's GP all stay in touch, monitoring Joe's condition and adjusting his medicine, so he avoids a return to hospital. It's clear that this pathway is better for Joe and his quality of life, and frees up hospital beds, meaning fewer operations are cancelled for other patients. It might seem ambitious, but the good news is that the personnel are already available. We are organising them into perioperative medicine teams, led by people with advanced skills in perioperative medicine to coordinate patient care in hospitals and in the community. Each patient would remain under the care of a perioperative medicine team throughout their journey. This would give GPs and surgeons a point of contact centred around the patient, providing better communication. Most patients are at low risk of complications and won't need a major change to their pathway of care. But for the growing number of patients at high risk, we can make changes to vastly improve their treatment. ANZCA has developed a world-first qualification in perioperative medicine with surgeons, GPs, and other doctors who specialise in critical care, geriatric medicine, internal medicine, pain medicine, and rehabilitation medicine. The qualification helps doctors identify surgical patients with complex needs and coordinate the best possible care through shared decision-making with patients and their families and carers. This can include a decision not to proceed with surgery. For more information, visit ansca.edu.au/aboutpom.